Good morning, welcome to Sports Radio 1310 The Ticket, George DeJohn Train Station Fitness Show. My guest in the studio today, I was thinking about doing the show by myself, but I decided to have a good friend of mine come in, Dr. Kevin Light. He's been on the show several times before, and he's got some information, some knowledge that I don't have about a study I'm going to bring to your attention halfway through the show, about 7:30 part of the show, where we're talking about if you're a sedentary person and you begin to get up and start exercising, excuse me, how exercise actually affects your DNA. But the first part of the show, what we're going to discuss, by the way, hello to you.
Hello.
First part of the show, what we'll discuss is there's going to be 4 questions I'm going to give you. They'll be rhetorical because you won't have a chance to answer them. I'll answer them for you. And I want to see what your health IQ is, what you know about keeping fat off, and how you're affected by these 4 questions in everyday lifestyle. First, let me introduce Kevin. If you've not heard from him before, Kevin Light, Dr. Light, well-known surgeon in Dallas, Fort Worth. He was a trauma surgeon with the U.S. Air Force for many years. And now he practices cosmetic surgery and age management medicine at the Texas Institute of Functional Medicine. You can learn more about Dr. Light and his practice at www.TIF as in Mary, F as in Mary, F as in Frank, M as in Mary, TIFM.com. When I talk about age management medicine, if you've heard or read anything about testosterone replacement therapy, Dr. Light is a person that I send everybody to. So we're going to do a show on that hopefully here in the next couple of weeks, and you can learn more about the benefits of testosterone replacement therapy. Anyway, coming up next, I'd like to give these 4 questions to you. I'll give them to you right now. You can think about them. The first one is, which eating tool will help you lose the most amount of fat? The second one, what is the minimum time needed to kick your metabolism in and keep it going, an afterburn, for 24 hours? The third one, what bad habit has the worst effect on fat around your waist? And also, if you exercise in excess without rest and recovery, you will, and then I'll give you 3 examples to choose from. So those are the 4 questions I'll give you, 3, 4, and then after that we're going to talk about the effects of overtraining. Now, there's not many people who deal with overtraining on this show. I don't talk about it hardly at all. I've done it maybe once before. But it's important that you recognize the effects of overtraining, and you think, well, George, I don't exercise that often, but let me listen anyway. Yeah, you probably should, because you might have some of these disadvantages, and be able to give yourself a little boost of fat loss or strength gain by doing some of the things that help you to stop overtraining and recover. What are they? Find out next. Coming up on Sports Radio 1310 The Ticket. It's 7:04. And you'll listen to Dr. Kevin Light with his commentary on this topic as well. I didn't just do that. Oh my God. Davey, I turned the... Hold on one second. Hey, it's George DeJohn, The Ticket. Oh, I got it. I almost got an Emergency Break of the Week nomination again. So I was moving the monitor. I have, all my bullet point notes. And as I'm moving it, I turned it off. All right, here we go. So Kevin Light, Dr. Light, is a good buddy of mine. He's in the studio right now, and he's here to chime in and co-host with me on the show to have a little fun today. His practice is the Texas Institute of Functional Medicine. You can visit more about him, learn more about him, TIFM.com. And I've got several questions. I want to check your health IQ. The first one I left you with was, which eating tool will help you to lose the most amount of fat? Here are the 3 choices. A, waiting 20 minutes before eating again. B, drinking a lot of water with each bite. C, chewing your food 25 times or more before swallowing. You don't have to answer this, but if you want, you can.
I'm going to go for the water.
You're going for the water? It's actually C, chewing more. Because what they found is it decreased caloric consumption by 12% in each person who chewed 25 to 50 times, which now it's like baby food. Who wants to do that? But still beneficial, easier on digestion. But they said it's also believed to lower your ghrelin levels, which is a hormone responsible for making you feel hungry.
Can I ask you a quick question?
Uh-huh.
Does it also have something to do with the fact that they say that it takes 20 minutes for your satiety centers to be satiated? So if you're slowing down the whole deal, then it gives time for your brain to catch up and say, okay, I'm full.
It does. They've not mentioned that, but I don't know if during that process, see, I don't know if you're gaining those benefits immediately when you start chewing as far as the hormone effect.
Right.
When you start chewing that many times, or if it just took you that many times to finish your meal, which I venture to guess that's part of it as well. And I thought of that. I thought it was 15 minutes also. So let's go to B, or number 2, the second question of my 4-question quiz. What is the minimum time needed to kick your metabolism in and keep it burning fat for 24 hours? If you've listened to this show long enough, you'll know the answer right away. A, an hour. B, 17 minutes of intense exercise. Or C, an hour and a half. And again, if you've listened to the show, you know the answer is going to be B. Burst training, 17 minutes will per bout of exercise will keep your metabolism flipping out after burn for 24 hours, if it's done properly. Here's the third question. What bad habit has the worst effect on gaining fat around your waist? Here are the 3 choices. A, staying up until 1 or 2 a.m. nightly. B, eating sugar in your post-workout meal. Or C, no exercise for 4 to 5 days in a row. I'll take a gander on that one.
I would have to, Now, staying up late at night frequently causes high stress levels, which always causes fat retention, but I would say the sugar one would be the right answer.
No, that's actually remember the sugar in post-workout is what they're saying as a
post-workout.
Is what I'm saying actually in a post-workout.
I gotta wake up.
Yeah, you gotta wake up. And I knew you knew this answer, and it is A.
Good morning.
It is A. People who stay up after midnight consistently for 3 days or more, this study was done a long time ago, have a 30% more likely chance of being obese. So, and they also found out in a study that in the same study that people who stay up until 1 or 2 in the morning nightly consume 300 calories more per day.
Wow.
Now, how many calories in a pound? 2,500. If you eat 300 calories more per day for 10 days, you've gained a pound. 10 days, there's, 30 days in a month, that's 3 pounds a month, 36 pounds a year. And you say, well, George, hold on. I do that all the time. I don't have 36 pounds per year that I've been gaining. No, you may not, but you might have 15 pounds to lose. Or if you don't, you're considerably flabby and you have stress, you have sugar cravings, you have trouble going to sleep, and it leads to adrenal issues like Dr. Light was mentioning. Here's the last one. If you exercise in excess without rest and recovery, you'll A, be the leanest you can possibly be. B, begin to have insomnia, weight gain, depression, and moodiness. Or C, expend any and all bad calories you consume. Go ahead.
B.
Yeah. Because now we're getting into the meat of the show. It's overtraining. If you're overtraining, there are more disadvantages working away from your goal than toward your goal. Some of the effects of overtraining. Now, you said, George, this is more your topic than it is mine when we spoke during the week. But do you know some of the effects of overtraining? Are you aware of that?
Pretty sure I know quite a few of them, yeah.
Give me several if you can, because I've got a bunch that I listed.
Musculoskeletal problems.
Well, what does that mean to the listener?
Oh, so you have, you get the normal soreness and burn after an exercise if it's done, I guess, well. But prolonged muscle problems, prolonged soreness, you just feel fatigued, you start having the shoulder bothering you, just prolonged
it's like, where'd that come
issues.
from?
Where'd that come from? That won't go away. Inability to sleep because your body is overmaxed, overstressed, doesn't have enough recovery time from the training. So appetite changes, I would imagine, would be a big difference. Energy changes, you just feel fatigued because your body's trying to fight you, trying to beat it up too much.
So let me go right down the list of everything I wrote down, and you're right on with every one of them. The effects of this, disadvantages and the effects you can recognize of overtraining are this. Soreness, general aches and pains throughout the body, like Dr. Light mentioned, pain in your muscles and joints. A sudden drop in performance, that's a significant one. If all of a sudden you're not able to move the same weight, the same repetitions, the same weight, and you think you just have an off day, but it happens again throughout the days of that week and week to come, or weeks to come, that's a sure sign. Insomnia, headaches, decreased immunity. You actually start to get sick. Decrease in your training capacity and intensity, moodiness, irritability, depression, loss of enthusiasm for the sport, decreased appetite, Increased incident of injuries, loss of muscle tissue, increased fatigue. So I think if you look at the person who says, well, hold on, I have all those things and I don't exercise at all. Well, there's that balance, right? We need the balance. If you have all of that and you don't exercise, well, get your fat butt up and start to exercise. If you're doing all of it and you're very lean as it is, and you're running marathons and doing 200 miles a week on your bike, and you're training for an hour and a half, 2 hours a day in the gym with weights, well, then you're most likely going to get some of the same effects. But the good news is you're able to reverse this really, really, really fast.
How long does it take?
It takes days to weeks depending on how overtrained you are. So I wrote down a couple of things, and there's something I remember from years ago when people were exercising too much to begin to recognize if they are overtrained. And this is not my idea. It's something I read a long time ago, and studies have